Welcome to Ask Prep, your trusted companion for NEET and JEE preparation. Today we will study about a very important topic of biology, which is endocrine system disorders, diabetes, hypohyperthyroidism. Let's start with diabetes, one of the most common endocrine disorders worldwide. Diabetes occurs when the body is unable to regulate blood glucose levels properly. Normally, after we eat, our blood sugar rises, and the pancreas releases a hormone called insulin, which helps cells absorb glucose for energy or storage. In diabetes, this process goes wrong. There are two main types. In type 1 diabetes, the body's immune system attacks the insulin-producing beta cells in the pancreas, leading to little or no insulin production. This usually starts in childhood or adolescence and requires daily insulin injections to survive. In type 2 diabetes, which is more common, the body becomes resistant to insulin, or the pancreas cannot make enough insulin. This often develops later in life, but due to changing lifestyles, it's now increasingly seen in younger people too. When diabetes is not controlled, high blood sugar levels can damage many organs over time. This includes the eyes, leading to blindness, the kidneys, causing kidney failure, the nerves, resulting in numbness and pain, and the heart, increasing the risk of heart attacks and strokes. That is why managing diabetes is so important. Treatment involves a combination of medications, a healthy diet, regular exercise, and monitoring blood sugar levels. In some cases, especially in type 1 diabetes, insulin therapy is necessary. Research is ongoing into newer treatments like artificial pancreas devices, advanced insulin pumps, and even stem cell therapy to regenerate insulin-producing cells. Now, let's turn to the thyroid gland, a small butterfly-shaped gland located in the neck, which produces thyroid hormones that regulate metabolism, growth, and development. When the thyroid produces too little hormone, it leads to hypothyroidism. When it produces too much, it leads to hyperthyroidism. Let's first look at hypothyroidism. This condition slows down the body's metabolism. Symptoms include weight gain, fatigue, cold intolerance, dry skin, hair thinning, depression, and slowed heart rate. In children, it can cause growth delays and developmental problems. One common cause of hypothyroidism is Hashimoto's thyroiditis, an autoimmune disease where the immune system attacks the thyroid gland. Another cause can be iodine deficiency, especially in regions where the diet lacks enough iodine. Hypothyroidism is diagnosed through blood tests measuring thyroid hormone levels and treated by giving synthetic thyroid hormone, usually in the form of a daily tablet. The goal is to restore normal hormone levels and eliminate symptoms. With proper treatment, most people can live healthy, normal lives. On the other hand, hyperthyroidism speeds up the body's metabolism. Symptoms include weight loss despite normal or increased appetite, rapid heartbeat, anxiety, irritability, tremors, heat intolerance, and excessive sweating. In some cases, the eyes may appear enlarged or bulging, a condition called exophthalmos, especially in Graves' disease, an autoimmune disorder that is a common cause of hyperthyroidism. Other causes can include thyroid nodules or inflammation of the thyroid gland. Hyperthyroidism is diagnosed with blood tests and sometimes imaging studies. Treatment depends on the cause and severity but may include antithyroid medications to reduce hormone production, radioactive iodine therapy to destroy overactive thyroid tissue, or surgery to remove part or all of the thyroid gland. Managing hyperthyroidism carefully is important because untreated, it can lead to serious complications like heart problems or osteoporosis. What's fascinating about these endocrine disorders is how a small change in hormone levels can ripple across the entire body. Hormones act on distant organs, and their effects are widespread, which is why endocrine disorders often present with diverse and seemingly unrelated symptoms. Understanding these patterns is key for doctors when diagnosing patients and developing treatment plans. From an exam perspective, knowing the feedback mechanisms that control hormone levels is essential. For example, the hypothalamic pituitary thyroid axis regulates thyroid hormones through negative feedback, ensuring balance under normal conditions. In diabetes, the problem lies with the insulin-glucose balance, which is tightly regulated under normal conditions but fails in disease. These principles help explain why symptoms appear and how treatments work. Beyond exams, these disorders also teach us important life lessons about the role of lifestyle in health. For instance, type 2 diabetes is strongly linked to obesity, poor diet, and lack of exercise. Public health campaigns worldwide emphasize the importance of healthy eating, regular physical activity, and weight management to prevent or delay the onset of diabetes. Similarly, iodine supplementation programs, like adding iodine to table salt, have been crucial in preventing hypothyroidism due to iodine deficiency, especially in areas where natural iodine levels in food are low. Modern medicine continues to make advances in treating endocrine disorders. Continuous glucose monitors and smart insulin pumps are improving diabetes management. Genetic research is uncovering new causes of thyroid disorders. Personalized medicine approaches, where treatments are tailored to the individual's genetic and biochemical profile, hold promise for the future. In conclusion, endocrine system disorders like diabetes, hypothyroidism, and hyperthyroidism are critical topics for both exams and life. They remind us how finely tuned the body's systems are and how disruptions can have wide-ranging effects. Understanding these conditions not only helps you answer biology questions but also gives you insight into the importance of early diagnosis, proper treatment, and healthy living. Thank you so much for being a part of the Ask Prep community. We truly appreciate your time and dedication to learning, especially when it comes to mastering biology, a subject that's not only essential for exams like NEET and JEE. If you found this video helpful, please give it a thumbs up, share it with your friends who are also preparing, and make sure to subscribe to our channel so you never miss an update.